Hello students, another topic of my presentation is embolism. Embolism is the occlusion of some part of the vascular system by any mass transported to the side through bloodstream. Actually, embolus is the detached solid, like I already explained in the thrombosis, that thrombus is that solid mass that when it is detached from its site and transported to another site, it is called as embolus. Or it may be any liquid mass or gaseous mass that is carried to a site distant from its point of origin. We call it as embolus. And if when the embolus, it causes the occlusion of some part of the CV system or any other site, then we call this process as embolism. About 99% arises from the dislodgement of thrombi, which I already told you, that is called thromboembolism. Because of the thrombus, it is known as thromboembolism. That if the thrombus, it is detached from its site of origin and then through bloodstream it is transported to another site, and here it causes the occlusion, then we call this process as thromboembolism. And because of this thromboembolism, when there is occlusion, it causes the ischemic necrosis of that distal tissue, which is known as infarction, leading to infarction. The types of embolism on the basis of consistency, the embolus may be solid, liquid, or gas. Solid are the maybe the fragments of tumor, detached thrombi, or foreign body, or bits of bone marrow, or erythematous debris, or parasites. And the liquid may be amniotic fluid or the fat droplets, and the gaseous may be the air in the syringe during IV injection or nitrogen bubbles. So during the IV injection, if there is an air in the syringe, and when it is injected IV intravenous, it causes the embolism, which is the gaseous embolism. And then the liquid one, which may be the fat droplet or amniotic fluid, and the solid one may be the thrombus, the fragments of tumor, parasites, erythematous debris, or the foreign body. On the basis of location and type, the embolism may be thromboembolism, maybe thromboembolism, which is because of the detached thrombi, leading to the infarction or necrosis of the tissue. Number 2 may be the pulmonary embolism. In 95% cases, the embolus, it originates from the deep leg veins above the level of knee, usually pass through right heart into pulmonary vasculature, causing sudden death, hemorrhage, infarction, or pulmonary hypertension. Example is the prolonged stay at or the prolonged bedridden patients, or those having longer flights. They do sit continuously, because of which there is DVT formation and deep leg veins thrombosis above the level of knee. They eventually pass, the clot then pass to the right heart into the pulmonary vasculature through inferior vena cava, and then finally when it blocks the pulmonary vasculature, it causes sudden death, hemorrhage, infarction, or pulmonary hypertension. So it's a very fatal form of extremely fatal form of pulmonary of embolism. Then the third one is the systemic thromboembolism, which is because of the occlusion of systemic arteries due to the thrombus that originate in left heart or a large artery. So when the thrombus originates in the left heart and it is dislodged, it moves from the left heart through aorta into the other parts of the body, leading to the systemic occlusion, arteries occlusion. So that is known as systemic thromboembolism. Systemic thromboembolism, the example is the infective endocarditis vegetations on the mitral and aortic valves, These vegetation may be the source of systemic thromboembolism. Then in patients with myocardial infarction who have developed mural thrombus, in patients with mitral stenosis and atrial fibrillation who develop thrombus in the atrium, that may be the source of systemic thromboembolism. The clinical effects of this systemic thromboembolism, that depends upon the size of that obstructed vessel, the availability of collateral circulation, and susceptibility of the tissue to ischemia. An infarction is common when the emboli they lodge in the arteries of the brain, heart, kidney, and spleen. Infarction in the intestine and lower extremities, they may occur only when large arteries are occluded or when collateral circulation in these tissues is compromised. Then the fourth one is the fat embolism, in which the fat globules appear and obstruct circulation, as in fracture of ribs or shaft of long bones, trauma to adipose tissue, in burns, in sickle cell anemia. Extrinsic fat or oil for therapeutic purpose as a complication of liposuction, acute pancreatitis, may lead to fat embolism because the fat globules they appear and they may obstruct any circulation. Then the fifth one is the air embolism. Air bubbles act as physical masses and may occlude major vessel, usually in lung or brain. Guys, in pulmonary embolism, if the emboli is small, it may lead to the minor branches of the pulmonary artery occlusion with no immediate effect. But if the numerous small emboli occur over a long period, the pulmonary microcirculation may be severely affected and may lead to the pulmonary hypertension. If the medium-sized emboli are there, they may lead to the medium-sized arteries occlusion and may result in pulmonary hemorrhage, but usually it does not cause any pulmonary infarction because of blood flow in the area from intact bronchial trees. And if there is a large emboli or massive emboli, it may lodge in the outflow tract of right ventricle or in the main pulmonary artery, where they cause circulatory obstruction and sudden death. So the clinical effects also depend upon the size of the embolus in a case of pulmonary embolism. One another important term is the paradoxical emboli, the emboli which enters the right side of the heart and passes through the interarterial or interventricular septal defects to gain access to the left side of the heart and arterial system. They're called as paradoxical emboli. So it's another important term. Firstly, we discussed the embolism, the embolus, the thromboembolism, then the types on the basis of consistency, these three, then the on the basis of location and type, maybe thromboembolism, maybe pulmonary embolism, very important. Clinical effect depending upon the size of the embolus. The systemic thromboembolism, the clinical effects depending on the size of the obstructed vessel, the availability of collateral circulation and susceptibility of the tissue to ischemia. And the fat embolism occurring during the road traffic accidents or the liposuction or trauma to the adipose tissues in burns, and the air embolism occurring during IV infusions, during the decompression sickness in the deep sea divers, or during delivery. And finally, the amniotic fluid embolism occurring during labor. This was a summary of the embolism. If you like my video, please do comment, like, share it with your friends, and thanks for watching.